I have had the privilege of serving in healthcare for over 20 years. And for me, this is a very, very important calling. I think a lot of people who work in healthcare choose this profession because of the connection they make with the healing purpose of our mission. What is very important to think about in your own career profession is that connection. What is it that is most important to you? Your values, both personally and professionally. And by the fact you're here today already tells me that you are connected to this particular profession. What's beautiful about it is that there's so many opportunities in healthcare. And I'll talk about those here in a little bit. But I wanted to start by talking about my journey. A couple of lessons that I learned as I have gone through my 20 years. I was trained to be a healthcare administrator. There is such a program, and as I received that education, it put me on kind of a business path trajectory to doing more of the business sides of healthcare. One of my couple of takeaways and advice that are really applicable across any individual in any career path is that I always focused never on a title. I always focused on the essence of the role. And it was what I was going to do and who I was going to be able to do that work with. And I had more extraordinary experiences by really focusing on what and who than on a title. A lot of times people get motivated by titles or they get motivated by a career ladder that they think is appropriate. And I just want to encourage you to really stay focused on what are skills you need to learn, what are experiences that you need to be exposed to, and most importantly, know the people you're going to work with, because that really is going to give you the most personally satisfying engagement in your work, in your profession, but it is also going to round you out in how you have experienced different skills and experiences. The other takeaway is to take some risks. There were some very unique choices I made. Opportunities I took advantage of where other people, 98% of people said, no, that's a bad job, or that's a funny choice. And for me, those risks and those opportunities yielded some very, very rich, deep experiences that really, really helped me in my professional growth. So you just never know what is the right step, but be true to yourself and make sure you're making choices for the right reasons. And that has paid off for me beautifully in my 20 years that I've served in this profession. A little bit about healthcare. So again, some of you are exposed to it, you've worked in it, others are new. Healthcare is under what you might call a transformative era. So you can't listen to the news, particularly in a political season, without understanding that healthcare as an industry has a significant impact on our country. And its economic impact is a very significant part of our gross domestic product. And so the cost of care is really becoming part of the conversation. In addition to the cost of care in the conversation, the regulatory environment. Welcome to the second most regulated industry on the planet. So there's high regulation at both federal and state level, and then there's also very intriguing innovation dynamics that are trying to transform us. So we're in this place where we're trying to shift from being a delivery system that was more you come to us, the doctor will see you now, to this consciousness of no, the patient will see you now. So a little less about physical, come to the doctor's office, come to the ER, come to the hospital, and really trying to figure out how to change our industry that is much more consumer-oriented, leverages information and technology in ways that we can't even foresee yet. The pace of change that's being driven by companies like Apple, Google, Amazon, and how they are going to impact health and healthcare delivery is at an all-time extraordinary pace. And so partnerships are forming in unique ways, care delivery models are shifting and shaping themselves differently. And the economic model of healthcare is also changing. We used to get paid, and still do mostly. The more we do, the more we get paid. And so you kind of got paid by activity. And that was the fundamental kind of business model for healthcare delivery. Now we're shifting into a future world, and we're kind of right in that transition zone, that we really should be paid for the outcomes of care. How do we do? How is the experience? How is the clinical outcome? And even more importantly, prevention and wellness and overall comprehensive health of members of our community. And so you'll hear words like value-based care. You'll hear words about preventative care, comprehensive care. And that transition as an industry, I think, is a fantastic one. It really does put the right purpose at the center of what we are trying to do for our communities, to keep our communities healthy and individual citizens of our community healthy. But you will hear about that, you'll read about that, you'll feel that in the organizations you work in. And each part of the healthcare industry might feel it a little differently, might experience it a little differently, but it's my belief this is a good and necessary transition as we really do begin to focus more on prevention, overall wellness, and value, the value of that experience and the value of that care. So those are kind of a little bit about what is behind some of the major change that you see. You'll also see a lot of partnerships forming, and I think this is another wonderful thing. No one organization can take care of the health of the community. So we have to figure out where and how we partner. So for Children's Hospital, for example, we're spending a lot of time talking to communities. What are the services within communities that have lots of children? And those children have lots of needs, either medical needs or, more importantly, often social needs. And how can we partner with churches, with schools, with community centers, with other not-for-profit organizations that exist in these neighborhoods, and figure out how together we actually create a whole new organization of partnerships that are touching these children and families. And so you see a lot of unique partnership conversations forming. And this is relevant for the choices you're going to make for where and how you want to work in healthcare. And I say this because you don't always have to think of it typically as a hospital system or a physician organization or a health plan insurance company. There are a lot of organizations out there that have healthcare related job opportunities for you to be considering. The other thing that's happening, our roles are changing very, very quickly. So how we think about care providers is evolving, how we think about support roles is also evolving. So you have a real opportunity to think broadly about your application of skills. A couple thoughts about the positions that you can think of within the industry. I kind of put them into 4 different categories. There's caregivers. And these caregivers usually are a licensed professional of some sort, where they've gone to school, they earn a degree and a license to practice. That license really dictates their scope of practice. Even today, schools are designing different curriculums. The roles of those licensed professionals are also shifting and changing. And how we utilize those professions to the top of their scope is very, very much on the minds of those of us that kind of lead this field. So, and there are going to be a whole lot of new roles that don't exist today that we are developing that are going to exist tomorrow. And so I think you're going to see continued flexibility, continued creativity in how we think about utilizing people's caregiving skills across this new model of healthcare. Then there are what I call the support givers. That's like me, right? I've never been licensed to care for a patient, but my job is to provide the management skills and the leadership skills to run an organization. And the nice thing about healthcare is no matter what your profession is, it could be marketing, public relations, communications, finance, human relations, engineering, almost every professional category that exists out there literally can be applied in the field of healthcare. So that is another unique opportunity. We are running, many of us, billion-dollar enterprises. And so when you think about that, you need all those skills. You need legal skills, risk departments, marketing departments. And so there is a huge opportunity again to take a different profession that isn't more of your clinically care-trained profession and apply it in healthcare space. The third category is what I call either the scientific or the cure givers. The pace of medical breakthrough and medical technology, it is an exponential change. People predict that there will be more change between the years of 2015 and 2040 than there has been in the entire existence of mankind. And so the exponential impact of that pace of change on society, and then on health in particular, and on medical breakthroughs and cures that are on the verge of coming, and medical devices and remote monitoring. Within a few years, all of us will be monitored with a little patch that we wear, speaking to our mobile phone, with hundreds of apps that have been developed to triage and sophisticatedly manage your health for you, alert you and your providers of care when something's wrong. I mean, those things are just literally a few years away. And so there's a whole nother dimension of health. And what's emerging there, data scientists and analytics, the engineering component pieces to do these monitoring devices. There's so many new jobs that really are kind of coming into the healthcare field that you can also be aware of within that context of both the scientific, the innovation, and what I call the cure givers. And then the fourth is the community givers, and those are those partnerships I spoke about. Again, you don't have to always look at a traditional healthcare organization. There are many not-for-profits, even some for-profits that are in this space that are really thinking about their role in the healthcare continuum and what that means. And so be creative, look broadly, and really, again, I'm grateful that you have chosen to focus on health, because I do think this is one of the more important professions that you can choose. As long as human beings exist on the planet, our health is going to be necessary to be cared for in some capacity. So it's an industry that never goes away as long as humans exist. How we do that care and how we partner with others really will be the future. But I am so glad that you have chosen this. I have found it the most gratifying profession that I could serve in, and continue to be honored to do what I do, and I hope you equally find that passion and that purpose in what you do. My last advice is be true to yourself, know your strengths, know your weaknesses, give good reflective thought, again, to what you do, why you do it, and who you spend that time working with, because it will make all the difference in your own personal life gratification and your service back to our profession. And with that, I will conclude here and just say thanks again for being part of this day, and good luck as you venture and journey forward in your careers. Thank you.